Joining us now live via Skype from here in Washington, D.C. for more insight is Gayle Smith, the CEO of the One Campaign. Ms. Gayle Smith, thank you so much for joining us today.
It's a pleasure to be with you.
So we have some good news with this report by UNAIDS. What does it take to stay the course?
You know, the news is really good, and let me just say a couple things about that. We're seeing the lowest infection rates ever. We're seeing some places in parts of Africa have reduced incidence of infection by 57%. So we've got all the evidence that we can succeed. What it takes going forward is a real investment of financial capital, and resources are robust, but they've fallen a little bit, and we've got to keep those resources flowing. Political capital, as you suggest, we're seeing the greatest successes where countries, where leaders, where empowered health ministers are out there putting the investment of time and real political capital in. And it takes one more ingredient, and that's real compassion.
Okay.
Because to get to the end of this epidemic, we've really got to focus on the people who are still in need.
So, Ms. Gayle, did anything surprise you at all, especially when we know how much impact COVID-19 has had on health systems in so many countries, developed or underdeveloped?
There are a couple of things that have been really interesting, looking at the AIDS epidemic and then going through the COVID pandemic. One is that the fight against AIDS has really built up health capabilities in a lot of countries, right? Because in order to fight HIV, you need the capability to test, to treat, to monitor patients, to care for patients, to collect data. All of those capabilities built over the last 20 years proved to be very, very helpful in managing the COVID pandemic when that struck. So there's a residual gain of strengthening the health systems. But I think the other thing that is quite striking is that the world's fight against HIV/AIDS, while it started in denial, it started in stigmatization, and sure, there's still some, but it started from a place of negativity. It changed, and it's made 2 decades of progress because of a lot of compassion, because people understood the dangers of this epidemic, but also the need to stand together and fight for those who were infected and prevent infections from going to others. And I have to say, compassion has been a powerful fuel in this fight. I would say it was perhaps a little bit less evident during the pandemic.
And before we wrap, what is the last mile to get to an AIDS-free generation by 2030? I mean, we seem to be on the right path.
I think there are a couple things. One, we can't just claim victory now and stop. A lot of people think this is over. It's not. We've proven we can do it, so we've got to keep going. The second is to focus on those who are the most vulnerable. So, for example, a huge number of adolescent girls and young women in Africa are extremely vulnerable. Their infection rates are very, very, very high. So focusing on them, empowering them, protecting them, and making sure that these people who have still not been reached and still don't have the low incidence that we want are the focus of our attention.
Okay, we have to leave it there. Thank you so much, Gayle, for joining us.
Thank you so much.